Let's talk about healthy and successful aging. So we've talked about how aging happens and some examples of how aging can go wrong. And now I'd like to talk about how we can, as individuals, as healthcare providers, can promote not only our own health, which is important, but also the health of all of our patients and family. So there are some important models of successful aging that should be considered, and there's some common features across models and how we define successful aging. So important to have a state of definition so we understand what successful aging looks like. So in general, there's an idea, of course, that there should be a maintenance of physical, cognitive, and psychosocial health. So there should be a lack of morbidity or stability of morbidity if it's present, a lack of disability so we can function. A perceived sense of well-being. It's not enough to just, on paper, look healthy. The individual should perceive that they're healthy and be happy with how they're currently functioning. And they should be engaged socially. There's some important predictors of longevity and successful aging that we should talk about. So when you're meeting a new patient, what are some things that you can look for that would help you predict that person's prognosis and to also provide some positive feedback, right? You're doing these things great. And then, these are the things that maybe we need to work on. So an absence of significant comorbidities or multimorbidity. Psychosocial factors are also important predictive factors. That individual's economic status, their housing status, marital status, the breadth of their social circle, as an example. And of course, there are genetic factors which are important contributors. About 20 to 35% of longevity may be genetic. There are other factors that are being studied and are of consideration for longevity and successful aging, including other genetic factors. Polygenic risk scores are being developed to better understand an individual's likelihood of living into later life, longer into later life, mitochondrial DNA, telomere length. And of course, there are some other important predictors like having excellent functional status. So not only are you having limited comorbidity, but you're functioning well. You're satisfied with your life and you're engaged socially. You're out there, you have friends, and if you don't have friends, you're working to make them. And how can we age well? Right? So how can we then take those predictors, take our predispositions, and make sure that we are intervening in our own lives, if we have some risk factors, to make sure that we optimize not only our lifespan, but our healthy lifespan. We want to minimize the period of disability each individual experiences. And to do that, there are a few very clear things that everyone should engage in. You have to maintain a healthy diet and weight. There are some diets that have been implicated in healthier living. Like the Mediterranean eating plan or the MIND diet, a combination of the Mediterranean eating plan and a cardiac healthy DASH diet. There have been some studies that have indicated that caloric restriction or periodic fasting may improve the healthy lifespan. Those diet interventions have some conflicting evidence in the literature. Periodic fasting has gained some momentum. The Mediterranean diet, however, has consistently shown to be very beneficial to the healthy life of individuals. And of course, you need to limit toxic exposures and should be working to do this for your patients as well, working them through reducing and eliminating alcohol from their daily life, reducing and eliminating cigarette consumption and other toxic exposures, engaging in regular cognitive activity, learning new languages, learning new skills, learning an instrument. Anything that strikes the individual of interest should be engaged in. Should not be just the same old things we always liked. We should push and do things new. And of course, engage in regular preventive care with primary care providers. Just as important is exercise regularly. Exercising regularly promotes health and quality of life. There's mixed evidence as to whether it extends lifespan, but it extends healthy life. So we are healthy and our quality of life is higher when we exercise more. Even low to moderate exercise 5 times a week, a total of 150 minutes per week, is shown to be the most beneficial in decreasing our likelihood of dying and in decreasing our likelihood of developing disability. Walking 30 minutes a day, it's all it costs us to stay healthy and limit our disability in later life. Engaging in regular social activities, regular hobbies and cognitive activities, And there may be pharmacologic interventions in the future. There are many interventions that are currently being studied. Most of these interventions are not ready yet for prime time, and there's uncertain benefit in humans. These are not recommended at this time by this talk or by any current professional society. Let's turn back a moment to Mr. Smith. Mr. Smith, as we mentioned, was sent for neuroimaging, an MRI of the brain in this case, with volumetric analysis. This analysis showed global atrophy, ventriculomegaly, chronic white matter ischemic changes. We wanted to establish a firm diagnosis for this patient, so we had discussed some interventions like PET scans versus amyloid PET scans with the family, which was declined. The clinical diagnosis was a probable Alzheimer's disease based on the available evidence. He was provided some management for his condition, including the available cognitive enhancers, donepezil and memantine. He was prescribed an SSRI, initially, as mentioned, sertraline for his depression, and we developed a person-centered care plan to optimize his physical and social and financial well-being. This included things like estate planning, developing an advance directive while he still had the decision-making capacity to do so. And we referred him to structured programming so that he could maintain himself socially and physically. He was sent to a memory-oriented day program. And his wife, who is just as important in this story, was referred to a caregiver support group and for caregiver education. I'd like to bring this talk as we're coming to a close with one more reminder about how we all interact with our families as they move through the aging process. This is a very touching video. So important to consider, as aging is happening to our loved ones and to our patients, roles change, understanding the physiologic changes of aging as a part of the life process can help all of us, both as providers and as individuals, understand the person in front of us and that the person we love is still present inside of what may be perceived as an aging body, that the person that we knew, that we loved, or that we cared for as a healthcare provider is still there and deserves respect and deserves to be understood, and intervention should be targeted in a person-centered way to the individual that's in front of us. So today we've discussed a large panel of topics that spanned understanding definitions of later life through the theories of aging, including evolutionary, psychosocial, and physiologic, through what we understand currently to be the physiologic changes of normal aging and how we as providers can encourage our patients and those loved ones in our life to age healthfully. I would encourage you to think through each of these, process all of the slides that we've read through today, and to bring your thoughts to the preceptor that you're working with in your clinical rotations. Help your preceptor, help your team better understand your aging patients, and to develop person-centered treatment plans that capture not only the important factors that have changed for an individual as they've moved across their lifespan, but also their strengths, that individual's strengths, so that we can improve their quality of life and capture what matters to them. Thank you all for listening, and I hope you all have an excellent day.